It's been exactly 1 year since I started HRT, and I don't even know if I'm in menopause for sure because I've been on birth control pills since I was 25 for endometriosis. And I had some liver issues, a bit higher bilirubin last year, so I stopped the minute pill, progestin only pill, and I was on it for the last few years. Before that, I was on the combined pill of synthetic hormones, of course, and some call them hormone disruptors because you don't produce your own hormones when you're on birth control. So I don't remember myself before I was on hormones. I was very young. Anyway, I was supposed to wait for my period after I got off the minute pill. My ovaries are supposed to resume their function once you get off the birth control, but mine didn't seem to be in a hurry to resume their function. They seem to have retired and moved to Florida but I didn't wait for a long time. I waited maybe for about a month and a half before I started taking progesterone first for a week and then spray, Lanzetto spray, just one spray. And I didn't feel any changes in the beginning. I noticed my hair got thinner. I think it's from progesterone. And it might be that I tolerated stress better because that was a very stressful period. I went to Croatia when I started HRT in the summer where my toxic family lives. But I still coped very well, so I think progesterone helped. And it should have anti-anxiety effect. And then I didn't feel any estrogen effect, but it was just one spray. It was a very low dose. Then I moved it to 2 sprays. Still didn't feel much or anything. And then I started with gel, and that's where I started feeling. I can bring something here to check. So these are my supplement boxes, and these are my. I want goat to show my little goat. So this is the gel I started, Oestra Clean 0.6. The full applicator is supposed to be equivalent of 0.75 milligram patch, which I actually didn't know. So it's not so easy to find out. Nobody knows anything when it comes to menopause and HRT, not even gynecologists. So this gel, I started feeling a bit of fullness in my breast, a bit of maybe better libido, not much else. The changes are subtle mostly. So you don't notice immediately, but the best thing about HRT for me has been that my tinnitus lowered to a very tolerable level, which was my worst menopause symptom. And also my libido and my breasts. I like how estrogen improved those. So after the gel, I only used gel a little bit, and before I moved to patches. And the patches, I started with 0.5, but then I too quickly moved to 1.0. Where are they? Patches. Because my gynecologist did recommend that I should move to 0.75, but I didn't listen. I should have. These are 0.75 that I skipped. I went straight to, these were German, Estramon, that I got in Germany when I worked there now for 3 months. And Evopod are the Spanish one, and these are 100. And on these, I was a bit too estrogenated, and because I skipped this dosage. And how did I notice it? Well, I felt good. I think my confidence grew, my libido definitely, my boobs definitely. I felt good, and I slept like a baby. But the boobs are a bit tender and painful, so that's a sign that it might be a bit overdosed with estrogen. And also in Germany, when I moved to 70, actually I started cutting this one after my trip to Morocco. And so I started using approximately 0.75. But I guess when you cut the patches, they don't release the same amount of estrogen. I think it's a bit less, or maybe it's just the glue quality, I don't know. But when I moved to German, 0.75 microgram 24 Stunden Estramon, which by the way gynecologists didn't even know the name of. She prescribed the wrong ones first. This seemed to have like a stronger effect. I was more estrogenized, my libido was higher, I got curvier, and probably, I'm not sure why, because I didn't cut them or because it's just maybe better quality glue, I don't know. But with these, after a while, I got a bit of spotting and pain that sounded like, felt like how do you call it? Endometriosis pain. And I researched a bit, and it turns out it was probably endometriosis pain. So I decided to up my progesterone that you have to also take, Sedigestan in Spain. This is micronized progesterone that I take vaginally. I was taking 200 milligrams every night, and so I upped my dose because of the of what seemed like a uterus pain, endometriosis reactivated, and it stopped it immediately almost. After a few hours, it was already less, and the next day there was no pain anymore. So yeah, you need more. Like, so now I take 300 milligrams every other night. I mean, nobody knows, nobody can recommend you really what to do. So there are groups, as I mentioned in the previous video, of women who are in the same situation on HRT or in menopause or perimenopause, and we kind of experiment and advise each other. So yeah, on my trip to Morocco, I also bought estrogen. They have it. It feels a bit like it's illegal drugs, because when my gynecologist approved it, my second gynecologist, the first one said no way I could take HRT, because they're all still afraid of the breast cancer scare that was debunked in the meantime. So officially, doctors who actually study it and then deal with studied this study that provoked all this fear, Women Health Initiative from 25 years ago, they concluded that it was misinterpreted and the risk is much lower, or no risk actually, that estrogen and progesterone in bioidentical form, that's what you get today, do not cause breast cancer, do not increase the risk at all. So my doctor finally proposed that I should. She only asked me if I sleep well, and when I said no, he said, well, I'll prescribe you HRT. And I was like, oh, but my mom had breast cancer in my age. And he said, oh, nothing would happen, don't worry, for 5 years on the lowest or lower possible dose. So I was like, okay, I felt like I got illegal drugs. And in Morocco, you can get them without prescription, but progesterone is the good one, micronized. You can take it orally, or I would take it only vaginally to bypass the first pass liver. And but they don't have good estrogen without prescription, only oral. And then from Germany, I came back to Spain in the summer, south of Spain, Valencia. And what happened? Heat happened, and the patches didn't attach. They started detaching, and I started noticing that my estrogen is lower, mainly because of libido and breast size. I mean, it's not a big difference, but I feel it. Also, I got a bigger tummy, but that might be connected with the blastocystis hominis that I also picked up in Morocco, and Dientameba fragilis that I'm starting just now antibiotics for. So yeah, I'm feeling lower estrogen. I'm not sleeping the same. In Morocco, even though I stayed in hospital, I slept like a baby because of all the estrogen. And progesterone also helps. Supposedly progesterone helps you fall asleep, but estrogen helps you stay asleep. And then I decided to move back to the gel that I'm lucky to have, because I didn't use it when I got it. I thought patches would be better, and I got the patches, and now I'm using gel for a month until it's not so hot, so the patches attach again. By the way, the German patches attach much better. I did go back to Spanish ones, maybe because I cut the Spanish from 100 to 75, but maybe it's just worse quality. They detached like the next day. That's it. My prompter is totally finished. Oh yeah, I wanted to say also, yeah, so this 0.6 gel is equivalent to this 0.75 patch. It's hard to find out, but I don't feel like it's the same. I feel I need more gel. We'll look into it. And also, I wanted to say, who knows what I wanted to say. I have a bit of a brain fog. That's also a low estrogen. I had a breast ultrasound, of course. I had a mammogram when I stopped the minute pill and took nothing for that month. And that's when I had mammogram, and that was the first out of 4 mammograms I had that was actually good. And well, there was really, like, my boobs were noticeably, there was nothing going on there. But whatever, this prompter, I turned it off. But as soon as I started estrogen, not as soon, when I started with spray and gel, as I said, nothing was going on. But then patches did make a change, and my breasts got fuller, and I did another ultrasound that showed that they do have cysts, but I've always had cysts, except for that month when I was off the pill, off any hormones. But those cysts are benign, and they have nothing to do with breast cancer. And also, when I don't recommend doing mammogram, especially if you're on hormones, because you're going to have dense breast tissue and they're not going to see anything. They're going to send you to do the ultrasound, where you can actually see if whatever you have is suspicious or not. So dense breast tissue is not a problem. It's not benign. It's not malign. That's all for today.
No, that's not all.